Here is the next video on part 2 of the glaucoma, which includes the topic that is the clinical presentation and pathophysiology associated with the glaucoma. So, firstly moving towards the clinical presentation, as per the types I mentioned here, the signs and symptoms associated with the glaucoma. So firstly, open angle glaucoma shows slow progression of the disease and it can show peripheral as well as optic disc changes. In case of closed angle glaucoma, there is production of prodromal symptoms, means appearance of initial symptom. After that there is full development of the symptom, that means production of rashes, fevers or blurry and hazy vision afterwards. Next, that is halos around the light, that means appearance of circle around the light region. That is, we can see in case of angels, they are having the circular network over their heads, or some spiritual persons are also having this kind of ring around their heads. Now, like cloudy and edematous appearance is also there at the corneal region, which can be occurring due to inflammatory responses. Again, ocular pain, nausea, vomiting, abdominal pain and diaphoresis, that means sweating, can also be there. Now moving towards the pathogenesis associated with the different types of glaucoma. So first, that is the open angle glaucoma. It is having variety of etiological parameters which can lead to cause this condition. So first, that is autoimmune reaction. So in case of autoimmunity, the T cell mediated HSP release is there. That means T cell mediated heat shock protein release in the retina is there, which are the proteins which are released in the stressful situation. So as there is stress, it can build up the intraocular pressure and can cause glaucoma state. The next, that is excitotoxicity. Excitotoxicity is associated with the increased glutamate levels, that is beyond 27 micrometer. So in this condition, there is vasoconstriction associated with the vascular network in the eye region, and retinal ganglionic cell death is also there. Now next, that is increased intraocular pressure. So in the first video we studied about this increased intraocular pressure and how it can leading to cause optic nerve damage. So next, that is optic nerve susceptibility to the ischemia. So due to ischemia, oxygen supply is not there, and due to that optic nerve damage can result, and this is irreversible condition, so it can lead to cause severe damages also. Next, that is dysregulated blood flow. So in case of this condition, there is increased perfusion rate, which can lead to cause rising of intraocular pressure, leading to production of the glaucomatous state. Next, that is other abnormal physiological processes. So that means the physiology is getting disturbed, and due to that there is excessive stress and strain associated with this posterior part of the eye, and due to that it can lead to cause optic nerve damage, which can again lead to this kind of condition. Now here the inflow and outflow is there. So inflow and outflow related to the aqueous flow. If there is imbalance between this condition or the pathway, it can lead to cause glaucomatous state. So here are some drugs which can increase the inflow, that means the production rate. So beta adrenergic agonist can increase the production rate of the aqueous fluid, and the other agents like alpha and beta blockers can reduce the aqueous flow. So outflow, that means the drainage rate or removal rate of aqueous flow. So here are some agents like cholinergic agonist, then prostaglandins, then beta adrenergic and as well as alpha 2 adrenergic agonist. They also can increase the removal rate of the aqueous fluid. So these category of agent prove helpful for the management of this condition also. Now next, moving towards the next part, that is the secondary open angle glaucoma pathophysiology. So it is an advanced condition associated with the open angle glaucoma, and as it is secondary condition, so it is occurring due to some other illnesses or other factors situated in the persons. So the factors like surgery, trauma, and exfoliation syndrome. So exfoliation syndrome is also called as pseudo exfoliation, and that is the condition in which there is abnormal accumulation of proteins in the drainage system or other structures of the eye. So due to that, this drainage system gets blocked and the produced aqueous humor cannot be drained out properly, and due to that there is increased pressure in this network which can exert the pressure on posterior part, and again optic nerve damage is there. Now next, that is pigmentary glaucoma. So in this condition, again there is heavy homogeneous pigmentation is occurring in the trabecular meshwork area. Again it can block the drainage channel, and due to that optic nerve damage results. Next parameter is systemic disease condition or systemic syndrome, which is associated with the lens changes or lens dislocation that can result to rise the intraocular pressure, and again production of glaucoma is there. Now next, that is the ocular inflammatory disease condition. So due to inflammatory response, there is a release of inflammatory cells which can raise intraocular pressure, and that can cause secondary open angle glaucomatous state. Now moving towards the next part, that is the closed angle glaucoma pathophysiology. So here I mentioned that blockade of trabecular meshwork is there, and in first slide also I mentioned about the blockade of drainage channel. But the difference between both of the condition is that in case of secondary open angle glaucoma, the iris is at normal position, so it is called as open angle, and in case of closed angle glaucoma, iris is moving towards corneal region, and due to that there is blockade of trabecular meshwork, and due to this there is rising of intraocular pressure which can lead to cause closed angle glaucoma. So here we are considering it as closed angle because the angle between iris and cornea is getting closed, and due to that trabecular meshwork function is affected. Okay, so here we completed about the clinical presentation and pathophysiology associated with the different types of glaucoma. In next video, we'll see about the diagnosis and evaluation outcomes associated with the glaucoma. Thank you.